Welcome to this version of April 20th Monday update, media availability. Thank you all for signing in. Unfortunately, we're struck by a tragedy overnight over the weekend in Nova Scotia, and we certainly offer our condolences to the family of the RCMP officer, Heidi Stevenson, who lost her life protecting her community, and thoughts and prayers to all of those injured and impacted by the senseless loss in this City Hall will be lowered to half-mast in honor of those victims over the next number of days, and our hearts are with Nova Scotia and Portapique community in Nova Scotia. Very, very sad announcements coming over the last few days, and we stand with them. We continue to work with our federal and provincial partners daily, and the encouraging news from the province today is that the modeling shows that the work that we're doing in terms of staying home and physically distancing from each other is working, and the spread of the virus and flattening the curve is working as well. That doesn't mean that we're finished or that we need to let up, but there are signs of hope that we're on the right path. And so the medical officer of health is indicating that the emergency remains in place and that we can continue to reduce the number of cases and deaths by continuing to do what we're doing in terms of all of the work we've done up to now. The clear and present danger, however, is that it still remains especially to our seniors and most vulnerable citizens and anyone else, quite frankly, an opportunity for us to spread that virus. And so we need to continue to stay the course in order to keep people safe and healthy. The province is investing $20 million to advance the medical research and develop tools and resources to combat COVID-19 and other infectious diseases through the Ontario Rapid Research Fund. We're calling on all of the province's world-class research institutions, post-secondary institutions, and nonprofit scientific partners to take action in the development of innovative solutions to track and defeat COVID-19. And I know our major institutions are well on their way in terms of participating in that kind of endeavor. The border with the United States remains closed, thankfully. US and Canada have agreed to keep their border closed for non-essential travel for another 30 days. The Prime Minister says closing the border has assisted in reducing the transmission of this virus. And so let's keep that in place until such time as we think it's safe to open up those borders. And we obviously see a different kind of tact happening across the border in terms of releasing or relaxing their stringent requirements to stay safe and physical distance. I'm not sure it's the right thing for them to do, and so keeping the border closed until such time as we know it's safe is also the right thing to do. More information is available on the city's website, outlining the various financial supports available to individuals and businesses and families experiencing challenges due to COVID-19. I know anecdotally some of my family members that have been laid off or are unemployed right now have already got a check directly into their accounts. And so money is starting to flow, and hopefully that helps many of the individuals in our community and businesses in our community that are struggling right now to stay afloat, pay their bills, do their groceries, and everything that is necessary to continue with a reasonable standard of living. So God bless the federal government for the work that they're doing. I think they're taking every measure possible to keep our economy as afloat or as buoyant as possible as we work through these enormously unprecedented challenges. In terms of city updates, I think we announced the other day that the leaf and yard waste collection resumes on a bi-weekly basis. So picking up during the week, not necessarily on your waste collection day. So beginning today, yard waste will be collected from homes in Ancaster, Dundas, Flamborough, Glanbrook, and Stony Creek. So we asked those residents to have put their leaf and yard waste out today. I got a complaint earlier from someone that was worried about leaf and yard blowing all over the place should the winds pick up or the rains come. And I would certainly encourage people not to overfill their leaf and yard bags and to find a way of folding down the top to protect it from the wind or getting blown around. But the reality is that we're going to be collecting sometime during the week. So if you put it out on Monday, sometime through the week, someone will come along and collect it. So if it's still there on Wednesday, don't worry about it. Someone will be there sometime during that week to pick it up. And also beginning next week, yard waste will be collected in the homes in Hamilton, on the Hamilton Mountain and across the lower city. Same idea, put it out following Monday morning, and sometime through that week, the collection will happen. And hopefully you can contain the leaf and yard waste in those bags and fold it up as tightly as you can so that it doesn't blow all over the place. No changes to the regular collection of garbage and recycling and green cart. All of that will continue as it has right from the beginning of this pandemic crisis, and will continue as well. In partnership with all three chambers of commerce, our local BIAs and Workforce Planning Hamilton, we launched a survey last week to find out how our local businesses have been affected by COVID-19. Over 400 responses keep coming in. And please continue to dial into investhamilton.ca. With this information, we can put measures in place to continue to support our business community in the weeks and months ahead, and start looking at how things are going to change and how we're going to come out of this when the rules do relax, whenever that is. So still, it's time to stay with spatial separation, staying at home as much as humanly possible. But at some point, we hope that we can relax those rules and start looking at how do we get businesses and in our community back up and running to some measure of success, bearing in mind coronavirus is still going to be with us in some measure or another. A final reminder that transit is for essential travel only. As you know, we're boarding at the back doors. It's currently free. We ask you to maintain your physical distancing and do not sit on the seats that have been blocked off. That's to ensure that there's physical distancing on the bus. And we thank all the bus operators for their continued support and making sure that our service continues for those that need in our community. And as well, if you're experiencing symptoms of COVID-19 and are planning to go to an assessment center, have been indicated that you should, please do not use public transit. It's just one way of spreading that to others on the bus. So get a ride. I think the taxi companies have now also come up with a protocol to ensure that it's safer for you to take a taxi to the testing center or getting a ride to the texting center. We want to minimize the spread of this virus, and that is one way of doing it, by not taking public transit to any assessment center. And lastly, you can contact public health hotline on any of these matters for information or for appropriate transportation to the assessment centers. You can call it 905-974-9848. So again, 905-974-9848, public health hotline, to get information on what's appropriate and how do you get transportation to an assessment center. I'm going to turn it over to our Paul Johnson now to tell us about any EOC Emergency Operations Center updates. Paul?
Thanks very much, Mr. Mayor. Well, as you mentioned, and as a lot of people are mentioning to me, interesting news coming out of both the federal and provincial government about where we are in terms of this surge of the coronavirus, and certainly lots of optimism. And I think it's great to have some bright news in our days around this about the fact that Canada as a whole, and certainly in Hamilton, we're trending in the better part of the lines as opposed to some of the worst case scenarios. Our health system has not been overwhelmed, and that is good news. And it is a sign that the things we are doing are working. So at the EOC, we're buoyed by this as well. But the reality is the message has not changed. Provincially, federally, locally, we are asking people to stay at home. The EOC has no plans to open up additional amenities anytime soon. We will take that advice. Certainly, provincially and locally, we'll be aligning ourselves with when that advice comes. So already, when word started to circulate over the weekend that models were looking a little bit better than they could have, sort of when is this going to open, or when can we get out and do that? And I would remind people that the advice, and you heard it today from our Minister of Health provincially, same message, stay at home. This is the kind of thing that is working. And as you can see from some of the outbreak spots, we still have a number of things to be concerned about, mainly in our congregate settings. To that end, I'm pleased to say that our emergency shelter at First Ontario Centre is doing its job. It is now up to its capacity, which was 50 people, and that has allowed us not to put more people into an already overcrowded shelter system. So it has lots of space, as you will know, from First Ontario Centre for people, and this also allows our other men's shelters to not be at or exceeding their capacity. So again, thank you to all of the partners that came together to make that work. So all of the closures remain in effect at the city of Hamilton. The enforcement is happening. I'm really pleased to see that the majority of the enforcement, particularly on the physical distancing, is of an educational amount. It's not about us going out there. I've heard a number of comments, is this just the way the city's trying to raise money? And the answer is not. It is a deterrent following guidelines, but it is not our intent to do that from a municipal bylaw perspective. I will say, though, there's been a little uptick in the amount of enforcement we're doing with some businesses choosing to open in a clandestine fashion, and our folks are there to monitor that and make sure that that doesn't continue. So the message is fairly clear from your Emergency Operations Center. We are still in the height of this emergency. We are still asking people to stay at home or very close to home and only travel if it's absolutely necessary for a variety of really essential things like work, getting to a medical appointment, going to the grocery store. Certainly, if you're out and about, walk in your neighborhood and explore your neighborhood. We do, though, see the signs that at some point this will start to release itself, but it's not quite yet. So thank you to everybody who's doing their part. And again, thanks to all of my colleagues at the City of Hamilton who continue to work very hard on behalf of our 540,000 folks that call this place home. Dr. Harvey, over to you.
Thank you, Paul. Just a couple of remarks. Our current case count is just over 330. I think the good news is that of those, over 40% of them, or 143, have now resolved their infection. So they're the beginning troops of individuals that have been infected by the virus, fought it off, and hopefully once we have serological testing, we'll be able to definitively identify that they've developed immunity, and they're both individually and the beginnings of herd immunity for our community. We also, as Paul, you alluded to, the current challenge point, not only for Hamilton, but really across the country, is congregate settings, long-term cares, retirement homes. And we currently are working with the staff and the leadership in a number of the homes across Hamilton to try to get this virus and its transmission under control. In fact, in a couple of those, we either are at the point or very close to the point of being able to declare that those outbreaks are now over. The last comment I'll make is this weekend was marked the opening of a drive-through testing center up at the Dave Andrzejczyk Mountain Arena. And just a reminder, anybody who has symptoms and needs to be assessed, call through to the number that the mayor alluded to, the coronavirus COVID-19 hot number, and follow the prompts to be able to get to one of our nurses and interact with them. And if it's indicated, they will facilitate. None of the assessment centers are intended as walk-in centers, but rather either working with your family doctor if you're having symptoms, and then us to be able to schedule an appointment up at one of the assessment centers. Thank you very much. Back to you, Mr. Mayor.
Thank you, and thank you, Director Johnson and Dr. Harvey, for all of your good work and your respective teams. You know, people need to know that there's an awful lot of people in the background making all of this function and work, both in public health and the Emergency Operations Center, as well as the city as a whole. So all of them are working, you know, double time to ensure that we remain functional and that we do everything humanly possible to protect lives and ensure that we can stop the spread of this virus. On the good news side, a big shout out to professors and students at McMaster School of Biomedical Engineering who have repurposed their 25 3D printers located in the school's Biomed Design Studio to 3D print face shields for frontline healthcare workers in Hamilton. They work with doctors at the Hamilton Health Sciences and St. Joe's to refine their initial prototype, and then they've produced over 300 face shields and more on the way. So a big thank you to engineering student Alec Fernbach and Professor Mike Noseworthy, the co-director of the School of Biomedical Engineering, and everyone else on the team. A great effort to ensure that some personal protective equipment is being developed and made right here for our frontline workers right here in Hamilton. A shout out to the Sean and Ed Brewing Company in Dundas. You'll like this one, donating up to 25,000 free beers to frontline friends such as healthcare workers. I'm hoping that they'll require our idea. That beer will be gone in no time. So all the frontline workers and healthcare workers, first responders, transit workers, and grocery store employees, I should say, you are all in line for free beer. All you have to do is drive by the brewery at 65 Hatch Street in Dundas, and a staffer will deliver the gift to your trunk. So thank you to Ed Madronich and everyone at the Sean and Ed Brewing Company for their contributions and bringing some good cheer to some great people that are really, really putting out for all of us on the front lines each and every day. We can't thank them enough. We continue to ask, the churches in our community on Wednesdays and Sundays to ring the bells in appreciation as well. And there's lots of other forms of appreciation being shown to our frontline healthcare workers and others, throughout our community, and all of them very deserving, and we're all very thankful. A shout out to Finlay Law as well, a Hamilton law firm, who are offering essential workers free advice on drawing a will and power of attorney during the pandemic. A bit of a sad situation that many in the healthcare field are looking to have these services done now, wills and estate planning, in a time of real and present danger. Obviously, our minds turn to making sure that we protect ourselves and our families. And so thanks go out to Sarah Old and everyone at Finlay Law, who are prepared to do that as a service to frontline healthcare workers as well. So good for you. And hopefully it won't be necessary for any of them, but looking after our frontline service workers and their needs into the future obviously is going to be very important. As well, a thank you to Rosalie Vizers, who continues to do our American Sign Language interpretation for the deaf. Thank you, Rosalie, for your ongoing help and support here. And of course, we thank all of our essential service workers, our paramedics, healthcare workers, police officers, grocery store workers, pharmacists, truck drivers, cleaning staff, bus operators, food manufacturers, firefighters, and all the other impaired frontline workers, all of whom are out there every day, keeping our city functional, looking after the sick, making sure we get groceries in the grocery stores. So for all of us who interact with all of these individuals in one way or another, be patient. These are folks that are working in very stressful environments. They deserve our patience. They deserve that we do our part, which is stay at home, as they do their part to ensure that they get health care looked after for us, or that people get to where they need to go by virtue of our transit system, or that the food continues to get delivered to the grocery stores and that there's a grocery clerk there to make sure we can ring it out and you can take it home for you. Be patient. I've seen some instances of people being abusive to all of these frontline individuals. There's no room for that at all. No reason for any of that to happen to any of our frontline healthcare workers. They deserve nothing but our greatest gratitude and respect, and certainly patience today is the order of the day. It's taking longer for everything. And so just steel yourself to expect that to happen, and just realize that we're all in it together. We're all in the same boat. None of us are any different. All of us have to be more patient as we speak. I do want to indicate there was a missive going around indicating that we should not be ticketing homeless individuals or marginalized individuals for physical distancing, or not adhering to the spatial separation. And I can tell you that not a single ticket has been issued to anyone in the homeless community as a result of that. In fact, we haven't issued a ticket yet. So far, it's been compliance by virtue of people being talked to and being asked to comply. And so far, everyone that's been asked to has done as they have been asked to do. And that's the way we want it. This is, as Paul had said earlier, this is not a revenue generating opportunity. This is an opportunity for everybody to do the right thing, which is to not spread this virus to others. There is support for you in terms of business, so continue to dial into investhamilton.ca or the hometownhub.ca. Visit both local BIAs through the social media pages. All of those are available on our website. I know our website is on the banner, as well as the public health hotline. And for those that are in crisis, and I'm sure there are many that are normally dealing with mental health challenges, now may be exacerbated by this crisis as well. There is help for you at the Coast Hotline at 905-972-8338. If you're in distress and you need help and assistance, call that number. Help is on the other end of the line. And for kids in our community, and there are many in difficult situations, there is help for you as well through the Kids Help phone line. So you can text at 686868 or phone 1-800-668-6868, and there's help for you 24/7. So dial into that assistance if you need it. Help is on the other end of the line. You can still donate blood, of course, and critical surgeries are still happening and blood is required. So go to blood.ca, look up your local blood donation clinic, and they'll be more than happy to take a contribution from you to help our healthcare system. And of course, if you have the resources, donate cash to the local food banks. Every dollar generates $3 worth of food for so many people now that are food insecure right now and need our help and assistance. Every dollar you donate, $3 worth of food gets purchased and then distributed throughout our community. So feel free to get a hold of your local food bank or through Hamilton Food Share. They'll be more than happy to take your contribution. They can't get enough contributions. There's always demand, and demand is ever increasing right now. And lastly here, thank you for everything you're doing in our community. As Paul had said earlier, yes, there's some hopeful signs, but let's leave them as hopeful signs for now. Yes, we have to have hope, and I think the weather is getting nicer. Hopefully, we can find a time not too far down the road where we can start to relax a little bit in terms of the spaces that we no longer can get to. But now is not the time. We're having success in these stats, in these projections, because we're doing what we're asked to. You're doing what we're asking you to do, which is to stay home as much as humanly possible, avoid that contact, and maintain that physical separation. It's as important now as it was a week ago, as it was 3 weeks ago. If we let up now, we could get right back into seeing those projections change, in short order. So thank you for that continued effort. The vast majority of you are doing a great job. I see compliance around the streets, and people understand why this is important. And that it's important because this coronavirus does not have a timeline. It does. It decides when we relax and when we need to open things up a little more. And that is when we understand and appreciate that we're getting on top of this issue rather than it continuing to overpower us. So thank you all for your great efforts, and I'll turn it over to Jazz now to field any questions from the media.
Thank you, Mr. Mayor. We do have 4 media partners on the phone today. Just as a reminder, everybody will have 1 question and 1 follow-up. We'll start with Joanna from The Spectator. Joanna, you can go ahead.
Thanks so much for taking my questions today. So when it came to the modeling that came out with the province today, the one spot that was a bit tough was long-term care and congregate settings. So I was wondering, Dr. Harvey, can you talk to us a bit about what exactly is being done locally to help this out? The province talked about there being 21 homes that had got extra testing, but it didn't say if any of them were here, and it's planning on expanding that. Can you talk about what the local, what you are doing to try and help this situation?
Sure. Hi, Joanne. So as I mentioned in my opening remarks, certainly long-term care, retirement homes have been an issue here in Hamilton. Our staff have been working closely with the leadership and the staff in those homes to make sure they have the appropriate PPE to reduce the risk of transmission. On at least 4 homes now, we've gone in and done what I would describe as mass testing to be able to very clearly identify who are the people that are infected with the virus, who are the people that are testing negative, so that, again, as I've said on numerous occasions in the past, the primary objective here is to decrease the risk of this virus being able to be transmitted from one individual to another. So certainly homes in Hamilton, I won't say we were on the leading edge, because I know one other jurisdiction that was doing this 2 weeks before we were doing it, and well before the province even talked about it. But it is one of the strategies to be able to try to battle these outbreaks in congregate settings like long-term cares and retirement homes, is doing this mass testing of everybody, symptomatic, asymptomatic, so that we get a clear view of, how extensive is the infection of the virus in these homes, so that we have a much better idea of, what efforts are needed and what strategies are needed to curb any further transmission.
Thanks so much. My next question is also for you, Dr. Harvey. I'm looking to find out what constitutes an outbreak in a hospital, because I know in long-term care settings, it's one case, but in our hospitals, there are 24 healthcare workers with COVID-19, and there are no outbreaks at Hamilton Sciences or St. Joe's. So can you talk about what does it take to be an outbreak in a hospital, and why, we're not in that situation when there are so many healthcare workers with infected?
Sure, and actually, technically, the one case in a long-term care or retirement home is a special COVID-19 definition. Traditionally, for influenza or gastrointestinal outbreaks outside of COVID-19, we would view that as we would need 2 linked cases to declare an outbreak. But because of the circumstance, that outbreak definition for long-term care and retirement homes has been made that much more sensitive to allow us to work closely with the homes and to, we'd rather risk on the side of over calling an outbreak rather than under calling it. As far as hospitals are concerned, so there has been an outbreak declared in a hospital, and I think actually it'll be declared over as of today. But in St. Joseph's Hospital Special Care Nursery a couple of weeks ago, there were 3 healthcare workers that were identified as infected. And so efforts have been taken, certainly by the hospital and with our support, to make sure that transmission didn't extend. And in fact, in that situation, all of the patients and all of the staff were also tested. That was probably the first place in Hamilton where, quote unquote, mass testing was done. And in fact, my understanding was it was between 50 and 60 test results that were done at that situation, and all of them came back negative. And again, we're now 2 weeks today, and there have been no subsequent cases, which would be the extent of the incubation period since those 3 healthcare workers were identified. So a pretty good indication that further transmission has not occurred. To come back to your question, I do want to highlight and pay tribute to our hospital colleagues, and we've known this all along. I mean, they are incredibly protective of both their staff and their patients. They have infection control practitioners full-time that have special expertise in this area. They have leadership in this area. So in fact, they're the easiest partners to work with because A, they know their setting much better than we do, and B, they're very protective of their setting. So you're quite right. There have been healthcare workers associated with both hospitals that have been identified as being infected with the virus. The issue for hospitals and for any institution is really the notion of, is there evidence of, or is there suspicion that the virus has been transmitted in the environment of the hospital? And certainly the hospitals, both through their occupational health departments and their infection control departments, every staff member, every patient that will test positive for COVID-19, they have a very rigorous approach to investigating all of these, really to look for where did that transmission occur? Did that transmission potentially occur within the hospital setting? And they will track down any possible breaches. As you may know, the hospitals for some time now have been under universal personal protective equipment. So masks, gloves, eye protection, really to protect all folks, certainly their staff wearing it to minimize the risk that they'll get infected from a coworker or a patient, and certainly to protect patients from potentially being infected by a healthcare worker. So for all of those identified cases, each one of them has been investigated, and there has been no suspicion, except for the one that I mentioned in St. Joseph's Special Care Nursery, where the transmission occurred in hospital and that there was any further risk of transmission.
Thanks, Dr. Harvey. Next question goes to Samantha Craigs from the CBC. Samantha, you can go ahead.
Hi there. Thanks for taking my call. The first one is a pretty quick one for Dr. Harvey. I know that last week the youngest person who had died from COVID-19 in Hamilton was 62. Do you know today how old the youngest person who has died from COVID-19 would be in Hamilton?
So over the weekend and today, we've had 5 further deaths, Samantha, and the youngest individual there would have been a person in one of our hospices who was 67 years old. And certainly being in a hospice, while the COVID-19 infection wouldn't have helped things, essentially they were in a setting to get support and comfort essentially in the last days or weeks of their life.
Okay, thank you. The next one, Mr. Mayor, you mentioned that no tickets have been laid for physical distancing. Would that be the bylaw as well as the Provincial Emergency Services Act? And do you know if that's also true for police?
For the physical distancing, that's both true for the police and for bylaw. On the business side, I know that there's been ticketed that businesses have been ticketed for illegally opening up. I think Paul Johnson might have some additional stats on that relative to the provincial requirements in terms of businesses, and in terms of group gatherings, I am not clear on that one. I don't think there have been many, if any. Paul, do you have any additional information on that?
I don't have the stats, Samantha. We could get you the actual numbers, but overall, everything has been low. These have not been volumes, but I think some specific questions, as the mayor said, were about the physical distancing bylaw, and our approach with the homeless population in our municipal law enforcement as well as the police is that unfortunately their home is outside, and so we're treating them very much like you would be treated in your home, which is those provisions do not apply.
So it's been zero for the bylaw and policing in terms of tickets issued. People have complied when asked to.
Thank you. Next question goes to Adam Atkinson from CHCH. Adam, you can go ahead.
Thanks. Hi, sorry I was a little late to this conference, but thanks for taking my questions. Dr. Harvey, can you please talk about the COVID numbers in Hamilton and the new COVID-related deaths in the city and whatever details you can give us about those deaths?
Well, as I mentioned, Adam, at this point, our total number of cases is up at just over at 331. We have a total of 16 deaths, with the most recent 5 of those, as I mentioned to Samantha, have been over the weekend and today. And again, like the rest of the world, certainly the rest of the province, the predominant group that is succumbing to COVID-19, not dissimilar from what we see every year with influenza A and influenza B, is those individuals that are older in age and have one or more other chronic medical conditions that they're also dealing with.
All right. Follow up for Paul. What are some of the positive signs you're seeing in this fight against COVID-19 in Hamilton?
I think all the way along, as I've listened and connected in with public health, our system has not experienced the sort of surge that could have happened. That was a worst case projection, and then you see that from an Ontario context and in a lot of spaces across the country. There are some troubling areas that have caused, I think, the province also to act, and that has been in congregate settings, primarily retirement homes and long-term care. So we've had a couple of moments where things haven't gone well, large outbreaks, staffing issues and the like that we've had to get on top of. But I think when you look at, for instance, some of the outbreaks in institutions where it's been contained at one, and then 14 days later cleared of that outbreak. That means their infection control pieces are working well. When you see the overall numbers and the rate of the growth of that numbers, Hamilton's always been doing fairly well. When you check in with hospitals and they talk about, having certainly some people hospitalized because of COVID, but not in the sort of overwhelming numbers that would have caused them to have to look at dramatic ways to deal with it that you've seen in other cities. Those are all signs that what we're doing is working. There's probably other things at play that we'll learn about well after this in terms of why our numbers were the way they were, but I think some of it is the things that we're doing, and that's the reason why I know how antsy everybody's getting, and including us at the Emergency Operations Center, to say how do we get back to some kind of normal. But until we're convinced that this is something that we can manage in a way that's, the virus isn't disappearing. We've just done a nice job of flattening that curve and elongating it. So we need to take that and say, hey, the things we're doing are working. Now, the next question will be, what are those steps we're going to do to slowly get back to certain things operating, but not sort of, as everybody said, there's no switch to be flicked, which will allow us just to go back to the way life was in at Christmas time or something like that, with everybody out and about. It's going to be a very measured, and it's going to take some time to get there. So some good things that have happened, but I would say that that's not today's numbers. That's been throughout this in Hamilton, and that's a credit to the work that's going on across a number of areas, much of which Dr. Harvey covered earlier.
Thanks, Paul. Our next question goes to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Hi there, this question's for Paul. I'm just looking for some more information about the added enforcement with businesses that are opening up when they shouldn't be, in terms of, even if you can give us numbers of sort of how many businesses, what types of businesses.
I will have to follow up with the direct businesses. Some of them were personal service businesses, but I don't have the formal numbers with me. So we'll follow up and get you the actual numbers on that. And again, given the size and scope of the business community in Hamilton, large and small businesses, it's minor. It is a reminder, though, to folks. I don't understand. I'm not a small business owner myself, but I do understand at one level the pain that people are going through and the desire for them to keep their business going. The challenges right now is that's not going to be helpful in what we're trying to accomplish overall with this pandemic. So we do have to do that enforcement, but the specifics are still very small. But there's every once in a while we get word that somebody's operating, and we go out and have a chat with them, and they close very often on their own, just very quickly. But other times we do have to assess a fine.
Fines are not small, by the way, Paul. Remind us what the numbers are. They're quite substantial.
No, the fines can be quite large, and so they can go into the thousands of dollars, depending on whether we feel there was a real desire here to just flaunt the law. And the province is very clear. They do not want these businesses open. And the reality is, it's just, this is something that we are in together. So it would be unfair to let businesses sort of skate and skirt around this, because every small business owner would love to be open right now, as well as large businesses, as well as any business. The city would like to be open right now, but we can't be. And so I think that's the important message to send out there. But in terms of specifics, between Jasmine and I, we'll follow up with the bylaw and get you the precise numbers.
Thank you. And my second question is for Dr. Harvey, and it's regarding the SWAT teams that the province announced would be going into certain long-term care homes and other home settings last week. I'm just wondering if there are any updates on any redeployment of hospital staff locally to those care homes.
Thanks, Katrina. No, and I think the province has really recognized that different communities have different challenges and different resources. Thus far in Hamilton, we felt very capable with staff and expertise to be able to work with the various homes that are in outbreak. And in addition, we had 10 days ago launched a kind of proactive reaching out to all of our congregate settings, residential care facilities, long-term care, retirement homes, and really, first of all, asking them to do an internal self-audit as far as preparedness, and then those that signaled back to us that either they had some concerns or we've reached out and working with them, because ideally we'd love to be able to prevent these kinds of outbreaks in these settings in the first instance. So the kind of SWAT teams that the province have talked about, we're running our own SWAT teams through public health in Hamilton. We have great connections to our hospital partners, and we know that if we needed assistance, they would provide all that they can. But at this point in Hamilton, that kind of SWAT approach, if you will, has not been necessary. And quite frankly, I hope that it won't be necessary, so that the province have those resources for other parts of the province that may not be as fortunate with resources as we are here in Hamilton.
Thank you, Dr. Harvey. And with that, that's all of our media questions, and I'll hand it back to you, Mr. Mayor.
Okay, thank you very much, and thank you, media, for continuing to dial in and sharing information with our broader community as well as the live stream audience out there. Do remember that on this coming Wednesday at 7 p.m. we have our virtual town hall that will hopefully answer some of any outstanding questions that are still out there, and that will be for 1 hour from 7 to 8 p.m. This coming Wednesday. I remind you all as well that all counselors and admin staff and all city hall staff are still working. All of the services that you can get online are still available to you. So do dial in if you're looking to get any of those services. From the city of Hamilton, they're still all available to you. And if you need your counselor for complaints about leaf and yard waste, call your counselor. If everything's working out really well, you can give me a call anytime. And 905-546-4200 is my number. I know that leaf and yard has been an issue for many in our community, and regrettably, no one wants to cut back on services, but it was one of those that needed to happen based on the personnel issues we're experiencing. And I'm grateful for our staff for coming up with a way to at least getting it collected. I think that's a positive step. So do bear in mind you have to keep it there for the balance of the week. If you put it out Monday and they collect it on Monday, all the better. But if it's still there Wednesday or Thursday, don't worry. They're coming to get it, and it'll be starting just as of today. So thank you all very much. Keep doing what you're doing. Again, it's not a time to let up, even though there's some positive news that all the work that we've collectively been doing is working. The reason that the model is looking better is because of that. And so let's keep doing that. Let's ensure that we continue to stay apart, stay at home as much as humanly possible. And hopefully we can all look forward to a better day somewhere down the road in the not too distant future. Thank you. Continued good success, and we'll see you at the town hall on Wednesday.